Welcome to the Memphis Fitness Collective. I'm your host, David Allen, and on this podcast, I'll be connecting you with the best of the Memphis health and wellness community. Before we dive in, make sure you're subscribed to the podcast and check out our website, www.memphisfitnesscollective.com, for all the latest episodes and links to all of our guests. That's memphisfitnesscollective.com. Let's begin. This episode is brought to you by NBS Fitness. NBS Fitness is the best gym in Memphis. They've been helping Memphians achieve their health and fitness goals for over 15 years through personal training, group training, and health coaching. And if you mention this podcast when you sign up for one of their training services, you'll get a free health coaching session. That's a $150 value for free. You can learn more from their website, www.mbsfitness.net. Check out their locations, services, and testimonials. And don't forget to mention the Memphis Fitness Collective when you sign up. mbsfitness.net, Memphis's best gym. Hey, welcome to the Memphis Fitness Collective podcast. I'm here with Trevor Ling of Peak Potential Physiotherapy, and we are excited to kick this podcast off and learn more about Trevor and his business. So welcome to the podcast, Trevor.
Thank you. Appreciate it.
Tell me your story. How did you get started in this, and what motivated you to open your business?
So my wife and I have been physical therapists for 20 years now, which is incredible to kind of think about. We started Peak Potential Physiotherapy and Wellness. It'll be 10 years in November. So we've worked in the outpatient industry and have worked for other people, have had dabbled in some franchises and things like that. But the big thing is that we felt people were getting disenfranchised with our normal healthcare model, be it physical therapy and or allopathic medicine. And we believed that God was telling us we could do it better. And I was working for someone else, and my wife kind of spurred me along, as I'm sure yours is kind of that conscience of yours, that still small voice. And I came home and she pushed over our business plan and she's like, that's our business plan. And so 10 years ago, we started that journey.
That's awesome. So what makes Peak Potential unique in the kind of physical therapy space? What was the gap that you felt like you needed to fill?
Right. So a lot of times people don't know what physical therapists can do.
Yeah.
So we are doctors of physical therapy now. We are basically your front line, for lack of a better term, primary avenue for anything musculoskeletal as far as an outpatient facility. Mm-hmm. And we believe people were just kind of getting put as a number. It's like if you go to a primary care doc or you go to kind of what we call a big box or run-of-the-mill physical therapy, you feel like a number. You feel like you're not heard. You're a diagnosis, not a person. That's one of our core values. They're people first and patients second. And we wanted to connect with people on that level and give a one-on-one, more tailored treatment progression for people. And that's what we believed we could do. and we look at someone as holistic as we can. So more of an integrative, holistic approach to physical therapy versus what people may believe. I don't know what your experience is with physical therapy. I'm sure you've had a few bouts in your life, but that's what we wanted to be different about.
Gotcha. Okay, very cool. What are some misconceptions about physical therapy? Because, like you said, I've been to physical therapists, and the average person, if they have some type of musculoskeletal thing, they're typically going to do, right? They're going to go to their primary care doc.
Yes.
Doctors are going to take a look at it and say, hey, I think you should go see a physical therapist, and they may refer them if they're part of a bigger, more corporate practice, they're probably going to get referred to something like that. So what are some misconceptions around physical therapy?
So first off is that you don't have to see your primary care doc to come see us. Now, you don't have to see your primary care doc or any doctor to come see a physical therapist. And so we have, and it's been since I came out of school, we have what's called direct access.
Yeah.
And that's why we're the musculoskeletal or movement specialist in that, because people can find us directly. People who always think that we're having turf battles, but chiropractors do a great job with this. They're great with marketing themselves as the spine specialist. Yeah. I'm sure if anyone went around, you're like, oh, I woke up with a crick in my neck or my back hurts. So like, oh, I know where I need to go.
Yeah.
But that's the thing, is that we can do that too. Yeah. We have that skill set, and we're considered an allied health professional. And so we're working, that's where Amanda and I have kind of said we're working in almost a foot in both camps. We're working on a individualized basis by ourselves, but we also are very much in conjunction with our normal medical model, which also we wanted to kind of steer away from the sick model versus the wellness model, which is what you're in as well.
If you speak more on that, like when you say sick model versus wellness model, like, well, what are you saying?
Well, like you said, you go to a primary care doc, you have an issue, an injury, or even if you're sick, it's like, here's some medicine. That's the allopathic medical model. They go through a very specific algorithm, unless you're with a really good primary care doc, and we believe we've found some of those that we've partnered with over the years. But they go through this certain algorithm, and you're like, oh, I did this, I did this, I did this. Here, take this. Come see me back in 2 to 3 weeks, and we'll see if it's better or not. So that's the sick care model, versus the well care model is more pulling you away from that disease state. And the buzzword now is functional medicine, where it's, kind of heal thyself. What are the things both that you're doing epigenetically or environmentally, and that you can move away from a lot of these disease states that we're talking about. And I believe physical therapy is this kind of unknown kind of thing that we can do, that people don't realize what we can do, which is another misconception, is we're not just exercise. Most people think of physical therapy and think of the person walking the guy down the hall, or here, give me a massage, or let me give you some straight leg raises, where you came in and a lady's doing deadlifts, and after we manipulated a joint and then we go load it. And people are like, well, why is that different? It's like, it's just how I've been practicing for 20 years, and that's why we believed we had something unique to offer our community.
Yeah, so I would say in my observations, there's the functional health versus what you said, you said sickness versus wellness. So in the sickness model, there's, I would say, a belief in the patient, like, I'm broken.
Yes.
Yeah. And then there's a belief in the system that your body's just this kind of weak, fragile thing, and that it's going to break. And when it breaks, we're either going to fix it with medication or surgery. And that your body is just a bunch of different segments that aren't related to each other.
And that's all we have, too.
Yeah. And so it's just the way it is. Bodies break, your body's fragile. Like, your elbow pain is not, they kind of separated from the fact that, like, you're in a bunch of stress, your sleep's terrible, all this other kind of stuff.
You're a whole person too.
And so that's what the functional or the wellness model is it says, fundamentally, your body's this amazing thing that has the ability to heal itself.
Yeah.
And that we're not just fixing, we're not just fixing the we're addressing a foundational issue, not just the byproducts of what
they'll usually treat symptoms versus what we like to say is root cause.
Right. Yeah, that's what I was looking for. Symptoms versus root cause.
Yeah, and that's the issue is that you'll get a lot of that, and someone will come in with elbow pain, and majority of physical therapists treat the elbow.
Right.
But when you look at things functionally, that's actually what we take everyone through as a functional movement assessment. Yeah. Is then you see all the moving parts that are connected, and that if one is, you can't whack one thing without whacking another, and you can't say, well, yeah, you're going to heal this tendinosis, which is a chronic issue, by sleeping 4 hours a night. And you and I like our coffee, but drinking 5 cups of coffee a day and eating out and all these things that they're filling your cup with bad stuff when you need to drain that cup and give yourself the margin to do all the things that you love to do. And so there is this biopsychosocial model or mind-body connection. I mean, how many people have you trained? You're like, put your mind in the muscle. Yeah. But you also know that your muscle then attacks your mind, and you can't separate the two. No. You're not an elbow problem. You're not a knee problem. You're a David issue with that as a symptom of an underlying issue.
It has a beautiful way of putting it. It's like you're not an elbow problem or a shoulder problem.
Yeah.
You're a complete human, and that symptom has many facets of input that causes it to eventually show up as pain.
Right. And pain is just an indicator of something else going on. That is your brain's perception of the signals your body's giving you. That could be misinterpretation, or it could be a real interpretation. And that's what people don't realize, is that that's also part of our training, is almost more of a cognitive behavioral kind of treatment. And what we call neurophysiological or neuromuscular re-education that we have to give people. I tell someone, I can get that knee joint movement. I can manipulate that. I can needle that. I can do all the things. But unless I then teach you how to load that correctly, you're coming to the gunfight with a knife, right? Okay, so you have to then. So our philosophy is one, figure out what your movement problem is. Where is that symptom coming in? Reset it, and that's all the things that we get to do as a manual physical therapist. Reinforce it with a few things that you get to do at home, not just here's a bunch of exercises for lower back pain. And then we reload it. And then once we reload it, then I send them to someone like you. It's like, now you keep it reloading. I mean, I've told people in the past little bit, is I'm on a crusade. Everyone needs to be pushing, pulling heavy weight. Yeah. And people don't realize that that's what we're called to do. That's what we're made for. I mean, you saw it when you were in Africa, I'm sure. Like, how many people there's out doing manual labor? We're not meant to sit and not do something. I'll tell you that our information age is, for lack of a better term, killing us. So I say the sitting's the new smoking, which yes and no. People polarize those things. But.
Yeah, I'll tell you a story about that. Yeah. So we're getting ready to go raft the Nile.
Yeah.
And we have our guides, and they're taking our rafts down to the loading point.
Mm-hmm.
And this guide has this raft on his head. And this is
probably one guy, too.
Yeah, I mean, the front guy kind of had it. Yeah. Basically, one guy had the entire raft on his head. The other guy was kind of guiding it. And when this is like an 8-person raft, I'm sure it weighs 200 pounds. I mean,
they're huge. Yeah.
And he's carrying it on his head over gravel barefoot.
Right.
We're just looking at it going.
And I guarantee that he has a disc herniation. Yeah. He has other things. He's got arthritis. He's got all those things, because my guess is he's probably in his 20s or 30s or maybe even older. You got 50 and 60-year-olds doing that stuff over there because their body's more resilient.
Yeah.
And that's what we need to do. We need to build that resiliency into our system, so that we can go enjoy and do what we want and need to be able to do.
Can you speak on that? You said he probably has a disc herniation and arthritis. And I think what we here in America often hear is like, you have a disc herniation. Oh, and then they identify as like, I'm a hurt person. And then that African guy for the Nile doesn't know he has a disc herniation and feels no pain associated.
Correct.
Can you speak on that?
Yeah. So there's lots of good research out with that. I mean, I'm going to tell you right now, actually, this is a great one. So for neck pain, most people have had neck pain, or we can talk to back pain too. This is more of a stark difference. But they took this study and they gave everyone MRIs. None of them had pain. Okay. And in each cohort, so 20 and 30-year-olds, 30 to 40-year-olds, all the way up to like 80, 90-year-olds, 100 people in each one. So huge study. None of them had pain. How many people do you think had a disc herniation when they were 20 and 30, between 20 and 30?
I think it's 40, 50.
Yeah, I mean, that's a good amount, right? 86%. 86% of people in 20s to 30s had a disc herniation, but none of them had pain. Right. So when I tell someone that, I'm like, well, wouldn't you think that disc herniations are normal? And they're like, well, yeah. And you can have one without pain. Yeah. And then I just looked at a study yesterday that was with back pain that, people with disc herniations, lower back pain, disc herniations, disc bulges, blowing out, all these things are just catastrophizing words that then play on our brain. Yeah. But 74% of them in 6 months healed. Yeah. Are reabsorbed with a conservative model.
What percentage? One more time.
It was I don't quote me on it, but it was 70, at least 74%.
The vast majority.
The vast majority. Yeah. So it's like, for me, I tell someone, it's like, would you bet on 74%? Like, if you went to Vegas, what are your odds? Not even 50-50. Yeah. And people are still betting on that. Yeah. It's more like 10% or less. I would bet on 74% all day long. Yeah. It's like, oh, I can put $2 down and maybe get 74% of the time, maybe get double that. Yeah. Of course I would. Yeah. Yeah. 86% of the time, I wish I had those grades in school, right?
Right. Yeah, I think that ties into what we were talking about earlier, is understanding that it's a bio-psycho-social situation. Yeah. And, the difference is that in Africa, socially, I mean, everyone's just doing it. Yeah. He's never been told otherwise. He's never been told, like, you got back issues or neck issues. Right. And so he just kind of goes on with his day. And then there might have been a day where he was like, my neck kind of feels tight.
But he kept moving.
They kept moving. Right. And eventually it went away. Yeah. And he was fine.
They've done studies with Africans and saying, and looking at imaging and stuff like that. Of course, you had, depending on what they do, they're like, you can't do imaging on someone because you're stealing their soul and things. But that's why you went too. But yeah, there's been studies on that, and there's been the same correlation, even probably more so. Yeah. I can't remember the specifics, but there's all that stuff is out there, but it's not being put in front of people and or being normalized. Yeah. Because that's the thing. I don't even like to use the term fix. Like, people come in that I've seen now doing this for 20 years that I saw 18, 20 years ago who find me again, even though I was in another part of the city. Yeah. And they're like, hey, I need you to fix me again. I'm like, okay. Even I've changed my practice, even the last 6 months. And that's one of the issues, is that we're also need to be willing to change. Yeah. You're training people a whole lot different than when you were at the big box gym. That we have a personal friend that you were doing this with, totally different than you are now. And that's the thing. If you're not willing to pivot, which is another one of our core values, if you're not willing to pivot, then you become stagnant. And that's where our sick care model and our allopathic model is with medicine and physical therapy too. It's not you're an elbow. You probably have some sensitization issues from having elbow issues for so long. I need to work on your neck and your brain a bit to retrain you how to be able to load that. Right. And that's the thing, is I'm not fixing, I'm guiding. Right, and if you can't guide someone along that and look at them as a whole and then integrate all of these different types of treatment that are out there, I mean, from you having cold plunging and all this stuff and sauna, and all these things are playing a role just to enhance our body's natural ability to heal.
Yeah.
And the problem is that there's just so much chaos around us, epigenetically, the stuff that we do to ourselves from EMFs and all these other things that those are so many other rabbit holes you can go down. It's just what can we do and how can we fit into that model to make sure that someone is living to their full potential.
Yeah.
No pun intended, but that's why we
Yeah.
we say peak potential, because everyone has a different, what they want to do is different.
Right.
And if we don't know what they want, is then we can't work towards that.
Yeah.
Some people just want to get out of pain, but that's usually just surface level. I mean, I think you could, in January, you have a lot of people join the gym. I want to lose weight, surface level.
Yeah.
I need to be healthy because I want to stick around and see my grandkids.
Yeah.
And that might be more of an emotional level, but then you have the physical level, like, okay, I'm overweight. Okay, I don't want to die early, but I want to stick around for my grandkids. So you have to get to almost that, not secondary, even tertiary level, where it's more of an internal motivation, or that internal locus of control versus external locus of control, that then someone's going to actually be motivated to make the change versus being a passive recipient of it. I believe that a lot of times physical therapy people think, oh, I come in and you do physical therapy to me. It's like, no, I need to teach you how to actually do this on your own. I tell people all the time, I want to teach you how to fish.
Yeah.
I don't want to be the maintenance profession where it's like, hey, come manipulate this, come needle this, go on your way and come back when you're broken again.
Yeah.
It's like, how can I do this? Teach you how to reset, reinforce, reload, and then you don't need me unless something falls, the wheels fall off and it's something different. That's hopefully what someone's coming back. It's like, oh, you were David who happened to have an elbow issue, but then you went to Africa and then you rolled your ankle and now you need some more help.
Right.
And that's what we become as our direct access profession, is we become your body's mechanic and being able to do that.
Yeah, I love it. I also wonder, you talked about like people kind of come in and thinking, I'm just going to do some physical therapy and get fixed, but we're not really knowing what their peak potential is. And I think some of it is just once you're exposed to the ideas and the thoughts and the processes, now you're more aware of what your actual peak potential could be.
Right.
And you also potentially, again, go back into like the thoughts and beliefs is, if you believe your body is this resilient, amazing machine that can do great things, like you become less scared of getting injured. It's like, you're going to get injured. Like, I know in the rest of my life, like, this stuff's going to hurt.
Right.
That's just like, but my body is capable.
Right.
And I have professionals that I can go see. And so it's like, I'm not going to be fearful in my life. I'm going to go out and do life with the expectation that sometimes I might get beat up and need to go get kind of,
you need some guidance
back onto the path. And that's okay. And like, moving forward, you're going to get hurt. It's just either from doing nothing or doing cool stuff. So
right.
might as well be for doing cool
and
stuff.
That's the thing. It's like people are always like, I have arthritis. I'm like, great. That's the wrinkles on the inside.
Yeah.
That's your price of admission or admission to be able to do great stuff.
Right.
And again, you can do that by doing stuff, or you can do that sitting around and have all the secondary disease states from that. Oh, I have diabetes. Oh, I have this. Well, because you have a sitting problem. You have a sedentary issue versus an active issue. Which issue do you want?
Yes,
right.
Exactly.
And that's where that catastrophizing comes in a lot. That's where a lot of times I feel people are fails, like, oh, well, don't bend over, you'll blow out a disc. I've had ad nauseum the amount of people who say, I can't tie my shoe, my disc is going to blow out. You're not fragile. The whole jelly donut thing is a misnomer.
Right.
Because it heals. I mean, it's cartilage, just like in your finger, just like anything else, it will heal.
Yeah.
But do I give it the right environment to heal? Or do I jump into going to have surgery or going to have an injection, which those are fine. There's many times that those are called for, but did someone do the right things before they got to that point is the big thing.
And either way, if you have surgery or get the injection, you still have to do the other stuff to prevent future issues and allow that healing to occur properly.
Right. Yeah. And again, build resiliency after you have had an injury is the biggest thing. But then you have that psychosocial model. I was listening to some things with pain, and it's like, well, people have the same surgery. You might have a knee scope and feel great afterwards and go doing Spartan races and doing your CrossFit stuff or your functional training and not have an issue. Someone your same age, same issue, gets the same thing in chronic pain.
Right.
But the thing is that's an injury that you had, like the surgery is an injury.
Right.
Then they're saying it's what did you bring into the surgery? Are you going through a divorce? Are you having a stressful situation? Right. Are you having all these things that you were able, or you have, your relationship and other things outside of things is healthy versus someone who's not.
Right.
And so same person, same situation, then it's the environmental things that then create chronic pain or not getting back to your full potential that you should be able to.
So walk me through, I'm a new client. Walk me through the process of what it's like to work with you guys.
Well, it's fairly, that's a good question. Well, because one is taking a full history. I mean, we don't know where to go unless we know where we start from. And so we want to understand you as a person. So what do you want to be able to do? I've gotten to know you over the years. It's like, I know that you want to go play with your kids. I know you want to toss them in the pool. I know you want to do these things and be able to lift in heavy weights. It's like, all right, great. Then I know where my end point is, or where my waypoints are along the journey. Where are you now? And it's like, all right, well, where are you now? How did that start? And so you're creating a story so that then you become their guide on that journey. And so once we do that and figure out where you are now, what you want to get to, then we kind of figure out how to build that prescription in the middle. And it's a physical therapy prescription. That's what we tell someone, because if you don't take it correctly, you're not going to get the outcome you want.
Right.
I mean, you had to take some antibiotics. What did they tell you to do?
Take them all. Don't get up.
And because people usually come in with that primary level of pain. And usually we can turn that, if it's acute injury, we can turn that down in like 3 or 4 visits. But then it's like, well, what caused that pain? And then that's that physical part, that's secondary. And then it's like, but what do you want to get back to? Then that tertiary. If we don't get to those things, then you may come back, and that could be a chronic issue, because we didn't build that reloading or that resiliency into your system to come back. So once we build that story, then it's like, take it from head to toe. What's your movement? I tell someone, we're taking a pulse on your movement, and then we're determining if there's an asymmetry. God gave us 2 sides, so we can figure out, is this side moving like the other side? Some people, both sides don't work, and that's fine. I get one side working just as well as the other side, and that's our goal, because then when we take that pulse again, hey, you're moving better. Hey, you get that fixed, moving like that, then that begets less pain, and then we start reinforcing and reloading that new movement so that you can build resiliency into that system.
Very cool. Yeah. So I mean, every person's going to have somewhat of a different prescription based on whatever their individual state is and where they're trying to be.
We tell someone it is a personalized plan of care or prescription, because if your goals were just I want to get back to walking, that's a bit different than you wanting to do plyo jumps and muscle ups and things like that. Those totally different things. But you could be the same demographic that you are now and have totally different goals. And then that changes that prescription. Now, a lot of the things that we do, manipulation, soft tissue work or massage, needling, whatever it may be, regenerative modalities like we were talking about with the hyperbaric or some of the the electrical stimulation stuff that we have. All those things are just things. Because anyone could do that. You could go buy those things and do that. But sometimes it is the pieces of the puzzle put in the right sequence in order to get the picture that you want at the end.
That makes sense.
And you can tell me if we have time for this story, but I have this guy. I mean, I see a lot of pilots or ex-military and very self-driven, but they also have been put into the let's fix this type thing, catastrophizing thing. And this guy is like, he's my age, maybe a little bit older, pilot, hikes, does all these things, scared to bend over to touch his shoes. Like he has said, he's like, yeah, I'm scared to do that, but he wants to do kettlebell swings and deadlifts and things like that. And he's gone through physical therapy. I tell people I feel like we get people after they've been through everything, and feel stuck.
Yeah.
And so that's the thing is we serve people to try to get that whole picture, even when you've tried everything and feel stuck. And it's sometimes it's they've done all the right things, but they weren't told in the right sequence, and they weren't brought into that other model of, hey, let's actually heal your brain a bit, because that is part of it as well. And he's like, wow, I don't fear touching my toes anymore. I can actually get up in the morning and do these couple reinforcements, correctives that I given him. He's like, and then I go run. I go do my stairmaster. I go do these other things. And he's like, I haven't done that in 15 years when they told me that I injured my back.
Right.
And I'm like, I just hate hearing that. I mean, I've dealt with back.
That's life that was stolen from him.
Yeah.
Because someone put a thought and a belief in.
Yeah. He hasn't. He lived in Europe and like alpine skiing. All of a sudden, he's like, I haven't been skiing with my family in so many years because I'm scared I'm going to hurt myself. And I'm like, what? And then it was just the other day that I was working with him and had him doing all these things. He was deadlifting 80 pounds. He's like, I didn't feel it in my back. And then I was working with someone else. I come out and he's putting on his shoes, kneeling down. And I'm like, are you scared to bend over to tie your shoes? And he's like, yeah. Like, you just deadlifted 80 pounds without pain.
Yeah.
You can tie your shoes. Right. And he's like, you're right. Because it's still that disconnect of physical versus what I was told versus what's hurt before. And it's just amazing when you see, and that's another reason why we do it, to see that light bulb moment on people and realize I can do this. Right. I mean, you see it all the time.
I'm a Brazilian
human.
I can do this.
Yeah. I will be harder to kill to put muscle in my body and learn some of this stuff and then enact upon it to have an incredible life, to have the joy that we've been called to kind of show to other people.
Do y'all take insurance?
Yes, that's usually one of the biggest questions that we ask, and that's one of our issues is that we have a foot in both camps as well, because we have been out of network and we are out of network with some insurances, but that doesn't mean you can't use your insurance. Right. People are like, oh, you don't take my insurance. I'm like, no, we do take your insurance. Let us see what that'll cover. Yeah. It could be that it covers it at a $20. Well, when I came out of school, it was like $5 copays and all this stuff. But now it's like people are having to drop $50, $120 on a copay or towards a deductible. Yeah. And that's just the way it is. It's like, when we were growing up and we were eating bad, we could go to the dollar menu. There's not a dollar menu anymore. It just hasn't happened anymore. So with that said, is yes, we take insurance. We determine how much your insurance covers, and we'll let you know what that cost or that investment is for us, because that's what it is. Yeah. It's an investment into the only thing that God has given you. What do you have? You have your time, which is this, you can't get it back, and you've been given one body. Yeah. And you want to use your body with that set period of time that we've been given on this earth before we're called back.
For sure.
Type thing.
What's maybe one kind of action step that you see broadly that most people could implement that would help them be more resilient, more
healthy? That's on your part, is get people to start moving and start lifting heavy weights. I mean, from the 80-year-old woman can still start deadlifting her body weight. Yeah. Like there's great studies out that say if you can deadlift your body weight or more, you're harder to kill. Yeah. I tell a study to every woman who's like, oh, I have osteopenia, I have osteoporosis, I can't do this, I can't do that. No. And this is my soapbox, is anyone over the age of 40 needs to be lifting weights at least twice a week. And there's long-term studies, year-long studies that if I'm on minimal viable dose kind of guy. So what's the least amount I can do to get the best results? Now there's always nuances that you can do to that, and that's where you and I can be like, hey, can we tweak this and make it even better? But if you can do a full body workout twice a week at high weight and low repetitions to build muscle in your body, you will decrease a disease now called sarcopenia. And that is, I believe it came out in 2016. They'd say this is sarcopenia. But you and I know it as if you don't use it, you lose it. That's just what it is. And so my soapbox, and this is my wife too, because then she's talking about the nutrition side of things, she's gone to the more of the functional nutrition side of things, is then how do you build that into your body in order to get where you want to be. But I digress a little bit, but it was that whole lift, push and pull, right? Train twice a week. And for women, they're like, oh well, I don't want to be bulky. You're not going to get bulky. God didn't give you the ability to be bulky unless you supplement with testosterone. We have more.
I've been doing this for 25 years. I'm still trying to get bulky. So
oh come on, I've seen the pictures. I've seen the pictures.
If you beat me to it in 3 months, then
there's something wrong.
There's something special.
Right? Yeah, you're like, I know how to do this. And so that's the thing, is that you won't get bulky. You'll feel stronger. You can increase your bone density. You can decrease risk for falls. You can decrease almost every. I think it's actually every cause of mortality can be decreased by exercise.
Yes, you lower your overall mortality risk.
Yeah, overall mortality. All the mortality risks, plus then you also have a mental issue. The only thing to help depression and anxiety every time is exercise. Right. I mean, they've even shown like those SSRIs, all those things are only like 30%, 50% at most effective. Yeah. But every time, if you exercise, you will feel better. 100%. And so that's the thing, is like, yes, but then it kind of goes into like, oh, well, physical therapists just want to do exercise. But it's like, no, we're that gap between where you are and what's going to make you a better human and stronger. We help you from here to there. And there's incremental effects to get that. To decrease pain, to increase mobility and function, to start working on some things. You might have to start with endurance exercising and doing your 3 sets of 15 to 20 reps. But I want to get you to be able to do 3 to 5 sets of 5 to 8 reps. And that's where the money is, so that you can, I tell someone, it's like putting away for retirement. Anyone under the age of 40 that I see, you have this window of opportunity that you can put away for your 40s and over. And then 40s and 50s, you just have to work harder. You can do it. You just have to know, I got to increase my protein. I got to supplement and do things properly. I have to, I might need some guidance along the way. I might need to get to a gym where someone can actually show me the right lifting techniques. But I mean, I have, 7-year-olds are like, I don't want to lift. I don't want to go over and do the barbells. That's fine. Go do the machines. I don't care.
Do something to get started.
But stick into that. We got to work you towards that rep range where it's a strengthening, the whole 3 sets of 10, and do this stuff line. That's good in that journey, not as an endpoint.
Well, Trevor, as we kind of wrap this up, let everyone know if you have any events coming up and where they can get in contact with you guys.
We put out events that we do kind of just on our social media, but peakpotentialpt.com. All social media is at Peak Potential PT. And then they can always reach out. There's multiple ways on our website. You can fill out web forms, you can ask questions, any of those things. But the biggest thing is you can call us directly. If you have a question, you call. And our front office has been really good about saying, okay, well, do they need to get in for an evaluation? Do they just need a phone call? Do they need a text or an email? And that's the thing, is we want to be available and there to help people guide them back to that end point of having that healthy, vibrant lifestyle that they wish they could have but didn't know how to get to. But no events coming up right now. We are going to have some workshops coming up, both from a physical therapy side and then Amanda from a nutritional side, because people just don't. it's cliche. People don't know what they don't know.
Yeah.
They don't know that we need to increase our protein. They don't know that creatine's one of the best supplements that you can take, and we only make 50% of it.
Yeah.
And then people don't know that us as doctors of physical therapy can fill that gap for people and be that guide for them, and not just be a passive recipient of exercise, but be an active participant in order to get them to reach that full potential that they want.
Awesome. Thanks for coming on the podcast, Trevor.
Yeah, I appreciate it. Thank you.